Welcome everyone to today's webinar. Our guest today is Andrea Khalid, whose presentation will focus on the use of cognitive behavior therapy and how it can help build the resiliency we need in order to get through challenging times. The focus will remain on those living with neurodegenerative disease, as well as their care partners, and how each can manage their thoughts and emotions more effectively. Andrea is a registered psychotherapist with over 10 years of experience in the psychology field. She has a background in neuropsychology and assessment, and in more recent years has focused on her passion for clinical work. Andrea graduated with a Master of Arts in Counseling Psychology before opening a private practice. Currently, Andrea is working with adults who are experiencing challenges such as anxiety and depression, stress, including caregiver stress, self-esteem issues, interpersonal conflicts, relationship issues, workplace challenges, diabetes, and other chronic illnesses. Andrea also has a clinical interest in working with first responders and their everyday work challenges, as well as providing counseling support to family members. Please feel free to add into the chat any questions you have as they come to mind. We will make every attempt to answer all questions after the presentation. And with that, let's welcome Andrea Khalid.
Okay, well, welcome everybody. Thank you so much for taking the time to listen to my presentation. So just as it was mentioned before, it's really going to be about building and maintaining our resiliency during challenging times. Now, one of the reasons why I really like to work on this topic is in my previous life, I worked more in neuropsychology. And I worked with the Memory Disorder Clinic here in Ottawa, as well as in stroke rehab and geriatric rehabilitation. So I did get a lot of work done with people experiencing a neurodegenerative disease such as dementia and Alzheimer's. I also have been working in clinical trials for over 10 years, looking at people with MCI, so mild cognitive impairment, Alzheimer's disease, as well as working with their care partners. So when I started my private practice here in Ottawa as a registered psychotherapist, it was very much a population that I was really wanting to work with and help serve. So I'm really happy to be taking part in this webinar to provide all of you listening just some sort of tips and some ways that we can, build our resiliency and maintain it during, difficult times, not just during this pandemic, but also in general, with everyday struggles, that you're likely experiencing due to whether it's Parkinson's disease or care partners and families. Just some tips and tricks as to what you can take a look at to help get you through these times. The topics that we're going to be covering today is really going to be resiliency, so what it is not, and some ways that we work from a clinical perspective to build resiliency with clients. So I primarily use cognitive behavioral therapy, but I also incorporate some self-compassion and mindfulness techniques to help enhance our resiliency during these times. So again, my name is Andrea Khalid, and I work as part of the Ottawa South Resiliency Clinic here in Ottawa. We're a team of about 7 or 8 now. And during this pandemic, we are all offering online services, so virtual therapy for those experiencing, mental health concerns right now. So the first thing that we're going to be looking at is, what is resiliency? What does it mean to be resilient? A lot of people have an idea already as to what it means, but I thought I'd provide with a pretty accurate definition from the American Psychological Association. So what does it mean to be resilient? It means there's a process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, such as family or relationship problems, serious health problems, or workplace and financial stressors. So one thing, it does not mean that those who are resilient don't experience difficulties or challenging times. In fact, it's stated that those who do consider themselves resilient have most likely experienced some emotional pain and stress throughout their lives. building resilience does take time. It doesn't happen overnight. And awareness of how unhelpful thinking patterns might be limiting our resiliency is key. So why is it important to be resilient? During very difficult and trying situations, it can certainly affect our emotions and our behaviors as well as our moods in a negative way, but it doesn't mean that they need to take over your life. Becoming more resilient can help you get through these challenging situations as well as create a more confident way in moving forward throughout your life. So as I said previously, I work primarily from a cognitive behavioral perspective, and there is a lot of research that does suggest that in using CBT methods, it does enhance our resiliency and maintain it. So it's really important to take a look at, what measures we use in CBT to help with resiliency building. So basically, what we know about CBT already is that it's an evidence-based psychological treatment, which helps with unhelpful thinking patterns. And the goal, of course, of CBT is to develop a better understanding of one's thoughts and behaviors and how they influence how we move forward and how we think about things. So in general, what the CBT model is that there's always a situation, no matter what the situation is. And then we have these automatic thoughts or images about the situation. And then we have these three things at the bottom, which include our emotional responses, our behavioral responses, as well as our physiological responses. So what the cognitive model suggests is it's not always the situation that influences the responses. It's actually our automatic thoughts or images. So the way we think about things really has an effect on our emotional reactions, behavioral reactions. So behavioral could be something such as avoidance, and the physiological reactions. So the way our bodies feel when something negative is happening, whether it's an anxious thought, whether it's sadness, or becoming angry, we usually can feel it coming on, whether it's, an increased heart rate, we're feeling hot or sweaty. We usually have some physical symptoms associated. So when we talk about cognitive behavioral therapy and how important it is to sort of manage what our thoughts are, I think one of the key things that we have to really know is when we're experiencing unhelpful or distorted thoughts. One of the things that I ask clients when they're having, anxious thoughts or depressive symptoms or anything like that is, what was I thinking just before I started to feel this way? So a good way to become more aware of what's happening in terms of your thoughts and how they're directing or influencing your behaviors or your emotions. It's what can you ask yourself when you're starting to recognize an emotion? So anger, sadness, or, the want or need of an unhelpful behavior, such as avoidance, excessive worrying, and the physiological symptoms. So what was going on? What was going through your mind right before you started to feel this way? That's a really good way of trying to figure out what our automatic thought patterns are. And then we can look into, challenging those thought patterns. So is the thought very accurate for what's going on right now? Does it make sense for me to be feeling a certain way or this heightened anxiety? Usually we feel intense emotions, and the physiological symptoms are quite significant as well. So sometimes we want to sort of measure whether or not what it is that we're feeling makes sense for the situation. So can we adjust the way we're thinking about it so that we don't feel these things so intensely or not? Now, one thing about CBT is it doesn't ensure positive outcomes. That's not what it is that we're really looking for. We want to be able to adjust our automatic thinking patterns in order to influence healthier responses. So it's not about shifting, negative thinking to positive thinking. It's really about balancing out our thoughts so that we can manage things better. So these are really some common, errors in thinking that we have, and also some distorted thoughts. These are very common when it comes to figuring out what's happening and what are the types of thoughts that we're having. So we have all or nothing thinking, so very black and white. So if I don't pass this test, that means I'm a complete failure. Mental filters, that's only paying attention to certain types of evidence. So more or less the failures versus any of the successes. Jumping to conclusions, this is very common as well. We tend to think that we can mind read. So, thinking we know what others are thinking, and fortune telling. So being able to predict what's going to happen in the future. Emotional reasoning. So assuming that because we feel a certain way, what we think must be true. So for example, I feel guilty. Well, that must mean that I have done something bad. And then another one would be labeling. So assigning certain, usually negative labels to ourselves or others. So examples like I'm nothing, I'm useless, or they're careless. So these are very common types of thinking errors that people experience. And those are the ones that we would want to try to challenge or think about, what's a more reasonable explanation for what's going on. So as much as I'm a firm believer, and research does suggest that CBT is very effective when it comes to thinking about things in a better way, a more understanding way. I also really like to use self-compassion in therapy as well, because I find that it's important, especially for those living with chronic illnesses as well as caregivers. We tend to be very hard on ourselves. So when we don't meet the expectations of how we feel we should be, we start to feel quite bad about ourselves, bad about the situation, and that's not very helpful. So in terms of self-compassion, it's really important that we're nicer to ourselves, that we're more kind with ourselves. So here's sort of like a definition by Kristin Neff. Now, she's a psychologist in the States, and she works very much within this discipline, so self-compassion, and she promotes it very well. So self-compassion involves speaking to and treating yourself the way that you would someone you love and care about, especially when you're having a difficult time, when you fail or notice something you don't like about yourself. Instead of just ignoring your pain with a stiff upper-lipped mentality, you stop to tell yourself, this is a really difficult time right now. How can I comfort and care for myself in this moment? And then another, instead of mercilessly judging and criticizing yourself for various inadequacies or shortcomings, self-compassion means that you are kind and understanding when confronted with personal failings. After all, whoever said that you were supposed to be perfect? So one thing that I thought would be interesting to see is there's just a 2-minute clip of Kristin Neff herself providing some, tips on how to look at self-compassion and what we can do in those moments when we're starting to recognize that we're being quite negative and somewhat hurtful to ourselves and how we speak to ourselves. So I'll just try to click it here.
First thing is just to give yourself permission to treat yourself kindly. A lot of people think that it's selfish or that it involves self-pity. It's really not. Remember, self-compassion recognizes the shared human condition. It's not, woe is me, poor me. It's, life is difficult for everyone. So, and again, because it helps you give more to others, it's not selfish. So giving yourself permission to be kind, knowing that it's going to help you be happy, it's going to help others be happy. Then concrete things like noticing how you speak to yourself, asking, would I say this to a close friend? Usually not. What would I say to a close friend? Can I try treating myself that way? You can do this in letter writing. It's very effective. If you're really struggling, write yourself a letter in the same way that you would, again, what you would express to a good friend in the same situation, but write that to yourself. And then you can go back and read it. That's helpful. Probably one of the most helpful things, though, because we're mammals, we are programmed evolutionarily to respond to warmth, physical warmth, soothing touch, and gentle vocalizations. when, as mammals, when we, just like think of a mommy lion and her cub, we're programmed for our bodies to calm down and to feel safe and to feel soothed. So one of the most effective ways to give yourself compassion is through some physical gesture, because you're actually tapping into that mammalian caregiving system at a physiological level. So finding some touch that feels comfortable. A really common one might be to put both hands over your heart, or maybe on your belly, or cradle your cheeks, or do something like this. Some people just holding their hand. That can let your body know that you care, and then sometimes it's easier for your mind to follow after your body has calmed down a little bit.
Okay, so I hope everybody can hear me again. So, that was actually just a really good intro as to what self-compassion is and how we can look at it. I've had some people think that it's very selfish to think about ourselves in that way and to be overly kind to ourselves. And what Kristin Neff has done, she's actually provided a lot of really excellent information on her website. So it's selfcompassion.org. And there are some really great helpful tips on there and a lot of really good information that we can all take a look at. She provides a lot of good tips in ways that we can look at our situations in a better light and be kind to ourselves. Now, a lot of us experience, there's negative self-talk that happens often. And when you recognize what it is that you're thinking about and how negative you are with yourself, it's important in that moment to think about, well, would I really treat somebody else the same way? Would I speak to somebody that I cared about in this way? Likely not. So that's a really good time to become more aware of when it's happening. So like I was talking about when it comes to CBT and being aware of our unhelpful thinking patterns, these are one of those times that we can take a look at it and be like, wow, hold on a minute. I really just thought about that in a negative way, and I was talking to myself in a negative way. So how can we be more kind with ourselves and more understanding with what's going on? Now, the ways that we can increase resiliency and also improve self-compassion is recognize that the situation that you are in is difficult. And it would be for most of us who are experiencing it. But how can we look at it and change our approach to it? So remaining aware of the things which are in your control, it's very important. So think about our sleep patterns, our sleep hygiene, exercise, eating well, and social connection. Usually we like to call those sort of the 4 pillars. So things that we really want to get back to and sort of take a look at. And it's like, what has changed? Has anything happened? Have I been off track with some exercise? Has my sleep not been that well? Have I not been eating that well? And then social connection. During the time that we're in right now with this pandemic, it has been very much challenging, more than normal. So, it is important. It's like, okay, well, if I can't go see somebody, what's the best way that I can, talk to my friends or talk to my family members? Well, it's to pick up the phone or, to do video chats, something like that. Those are things that are really important. And I always like to think of those things as a really good baseline to see how we're managing, how we're doing. So has our sleep been affected? Are we not getting enough activity or as much as we had before? So in terms of exercise, during these times when we're pretty much stuck within our homes, it's difficult. Maybe we're eating more than normal. Maybe we're eating less than normal. And then, of course, that social connection. They're really good. They're good baselines to take a look at and to see where we have sort of faltered or what has changed in one of those. One thing as well, especially as, sometimes when I talk to caregivers, it's very much this way. And also people living with chronic illnesses, we tend to set ourselves up with very unrealistic expectations. So I think it's important to be more aware of that as well. So know what is reasonable for the current situation. So what can I still do given the limitations we are facing right now, instead of look at all of the things that I can't do because of what's happening right now. Affirmations. So there's been some research that came out recently about, we talk a lot about gratitudes and how it's very important to look at what we're grateful for. Absolutely. to be grateful for certain things is very important. But I think what might be equally or even more important are some personal affirmations. So the way that we look at this would be, recognize the things that you are doing throughout the day. So that can make your day a little bit better. And it could be absolutely anything, whatever is important to you. So, I put in examples. So having a warm cup of tea or coffee, or speaking with a friend or a loved one, watching something funny, having a warm shower, or even cleaning a certain space in your room or in your home. It's really important to look at these things that we are accomplishing throughout the day, because if we're focusing on all of the things that we're not doing, or all of the things on our lists that we didn't get done, we're not going to feel very good about it. It's important that we don't just focus on the negatives and that we focus on the positives. So, maybe it is a simple thing like, having that good conversation with somebody, or, emptying the dishwasher, getting things done that, sure, they might seem like everyday things that everybody tends to do, but they're important to acknowledge. And so I always say to clients, if you can think of 3 things that you've accomplished throughout the day that you're happy about, let's think about those things versus all of those things that maybe weren't so great throughout the day. Now, mindfulness is another thing that I like to bring into sessions with clients. Oftentimes when I do bring it up, there's a lot of hesitancy because mindfulness, we associate it, with meditation, and what does that look like? And, oh, I don't have time for this. It takes too much out of my day, or I don't have, a quiet space to practice or anything like that. It kind of sounds intimidating when it's brought up. But in the way that I think about mindfulness this is just sort of a definition that came from the APA, so the American Psychological Association. So it's a moment-to-moment awareness of one's experience without judgment. So in this case, mindfulness is a state and not a trait. While it might be promoted by certain practices or activities such as meditation, it is not equivalent or synonymous with them. So the way that I think about it, and I like to incorporate it into, daily activities for clients, is very much sort of like those mindful moments. I don't send people out with the idea that you have to go and meditate for, 30 minutes or an hour a day. It's not something like that, although that can be beneficial as well. But the way to sort of get used to it and how to improve our ways of thinking about things, these moments throughout the days where we can not focus on the worries or the concerns that we have, and just focus on the present and what it is that we're doing in that moment. So it's like noticing the little things. So how something might taste, how it might smell, how it might feel, and what it looks like. So for instance, if you're drinking a warm cup of coffee, you can focus on what that smells like. Is the mug hot? Is it warm when you're holding it? When it goes into your mouth and it goes down your throat, what does it feel like? It's really important that we take some moments throughout the day to be able to be very present with what's going on. It does provide some relief from all of the other concerns that we have. And there has even been some research that it does help with sort of like that rewiring of the brain. If we're constantly on edge or we're constantly thinking about things, our brain really doesn't have much time to just take a break and a breather. Being more aware again and accepting of our emotions and our feelings. And, it's really just those small things. And like I said, even if it is a warm shower, focusing on the temperature of the water and what it feels like. It's even as simple as recognizing our breathing patterns. So recognizing our breath and what it feels like going in through the nose and out through the mouth. It's really being present in what you are experiencing in that moment. These are just some apps that I'm familiar with and that I've heard from clients as well that can be very helpful. Now, these are, there are some longer mindfulness meditations that you can find on these apps, but they're primarily for, everyday usage. So, there can be some for as short as 3 minutes, there can be some 10-minute ones, 15-minute ones, and you get to choose. I myself have used Buddhify, so the top one there, which I find very helpful. You can use it at any time. So these are mindfulness practices that you can use throughout the day. So even during activities. And they're guided, which is helpful as well. And then Calm, I've heard some really good stuff about, and as well as Headspace. And then some basic breathing exercises or relaxation techniques. Those are very popular as well. And again, they help ground us, especially when we're feeling quite anxious or overwhelmed with what's going on. And I know that Headspace is actually, I think they provide some free, you download and you have, several weeks for free to give it a try. But they might be worthwhile just checking out to see if it's something that might be beneficial for you. And one thing, during presentations that I've done with Parkinson Canada before, and working with a number of caregivers, there are some common emotions that are felt given the situation, or even just given the diagnosis and having to work through that. So common emotions that are experienced are really, grief. So when we talk about grief, it isn't just about losing somebody. It's really significant loss in general. So, given just say the pandemic and what's going on right now, many would be, really feeling some grief towards just the loss of, the daily routine or some exercises and schedule. If appointments were very important and you went out to several different appointments a week, I'm sure that those appointments have been affected in a way that, you're unable to go, or people cannot come into the home because of what's happening. And, we get so used to it and we get into a habit and a pattern. And when we lose something that means so much to us, it can provide us with a lot of grief and a lot of hurt. So it's working through that and adjusting, but being more accepting of what is happening, not necessarily accepting in the sense of you need to feel okay about it, but just being more understanding with yourself. So, okay, well, I no longer have my exercise appointments or my physio appointments that I'm going to be attending outside of the home. What am I still able to do while I'm at home? What can I do? Even our schedules have changed significantly. So if we're all at home now, it can change our eating habits. It can change our activities. It can change our sleeping habits, a lot of things. So we want to try to maintain some sort of structure to our day. So whether that is going to bed at, relatively the same time, or getting up at relatively the same time, eating, breakfast, lunch, and dinner at about the same time. So maintaining some sort of schedule can be really beneficial. Anger is another very common emotion. When we think about anger, how many times have you really been on your last nerve? Feeling angry and frustrated is normal. But what is important is to identify who you can talk to and who you can, just vent to. We all have, times where we just want to vent. We're not looking for advice. We're not looking so much so for support or to be told what we should be doing. It's just being able to vent and let people know what's happening and what we're thinking and what we're feeling. Loneliness, of course, with isolation, on a normal day. So let's just say even before this pandemic, loneliness is something that, many people who are experiencing or living with a chronic illness and their caregivers experience, whether it's because there's been a decrease in people to talk to, friends aren't around as often and that sort of thing. We feel it even more so right now. So, finding ways of getting out, finding ways of, just slipping out of a little bit of our routine. So whether it's sitting outside, going for short walks, reaching out to people via FaceTime or Skype, or however you've been doing it, these are really important times to think about that. And then, of course, sadness and depression. So we do know that, living with Parkinson's disease and caregivers, they're both populations that are more vulnerable to developing depression. So it's important to recognize what the signs are and reach out to, your family doctor or physicians that you're in touch with. Let them know what you're feeling. And again, I'm going to go back to those 4 pillars. So remember how important it is that eating well and sleeping and social connection and exercise can be for mood. They're very distinctive. They can help people, and research has proven that they are very beneficial for that maintenance of our mood. So when we're recognizing, we're feeling a little bit more down, we're feeling a little bit more depressed, what can I sort of pick up? What have I been missing? What can I reintroduce to our daily routine, so that I can, again, feel a sense of accomplishment and get things done? That would be another good one for affirmations, like I talked about in the previous slide. What are the things that you were able to do today? If it was just a short walk around the block or did some exercise within the home, those are things that we've accomplished and that we should be proud of and we should give ourselves credit for. Another common emotion would be guilt. So feeling as though, you're a burden to yourself or to somebody else, or you're not doing enough. And acknowledging these feelings and discussing them with somebody that you can confide in is really important. I often suggest writing down our thoughts and feelings, or even thinking about what your loved one would say if they knew how much you were struggling right now. These are very important things to think about. And oftentimes we don't want to put a burden on somebody else by not talking about it. But if we don't talk about what's happening for us or what's going on, we can't expect that others know how to help us. So then we go back to sort of like that mind reading. If we think that we know what somebody else is going to respond with, we might be hesitant in bringing anything up, but we won't know until we talk about it. So if we don't let others know how they can support us, we might feel that we're not being supported at all. So when it is important to reach out and let somebody know what it is that can be helpful, it's really important to do so. And, this is pretty much, this is the last slide that I've got for this presentation. But these are some things to remember. So things to be mindful of. So like I just talked about, you really want to try to maintain some structure to the day. It's important to focus on the things, that you can do versus the things that you can't do right now. Recognizing when your thoughts are influencing unhelpful responses or reactions. Being kind to yourself. So think of self-compassion. Would you talk to somebody else in the way that you're talking to yourself? And of course, reach out if you need to. Living with Parkinson's disease or caring for somebody with Parkinson's disease can be very challenging during normal times. But what we are dealing with today, and the social isolation and social distancing, and it can make it that much more challenging. So just know that there are always people that you can reach out to. And I'm sure, just like, myself, I'm sure others are providing, other therapists or counselors, physicians, they're providing virtual care. So whether it's you call them on the phone or you talk to them through a virtual platform, the services are still being offered. So if you feel that you need to talk to somebody, absolutely reach out. There's always somebody there that you can talk to. And that's basically it for my presentation. I guess I'll open up for questions now. Thank you so much for taking the time to listen. And I hope everyone stays well.
Thank you, Andrea, for a very informative presentation on this important topic. As Andrea mentioned, we are now going to be open for any questions that you may have. Please enter them into the chat, and we'll attempt to address all of the questions before we conclude. With that, there's a couple of questions that have shown up. The first is CBT something that I need to have a counselor for, or can I find resources to try this for myself?
That's a really good question. So it really depends. I know that there are a number of clinician workbooks out there that people can take a look at and read. It's always recommended that you work with somebody who's very informed on what CBT is. It can be very tricky, as much as it is, you can work through it and there's a lot of information out there. It's not as easy as it seems. So even just recognizing our automatic thoughts, sometimes we're not very accurate with finding out what those are. But certainly there are a lot of really good books out there. There's one that I actually use with clients. It's called Mind Over Mood. That's a very popular CBT workbook that a lot of people get a lot of benefit from. There are a lot of worksheets involved in it. So you can give that a try. And if you notice a benefit and that you're doing things and you're feeling much better, then by all means, and that's wonderful. If you're still sort of struggling with some of the things that CBT has to offer, then you can absolutely reach out to somebody who does offer that type of service.
Okay, thanks for that. A related question to it is, how long does it take for me to notice some sort of effect?
Good question again. It really depends. So they say usually when it comes to CBT in general, depending on what the issues are that people are coming in with, you can notice a change within probably maybe 6 sessions or so. I think, like I said, it's really starting to notice and acknowledge the correlation between how we're thinking and how we're behaving and what we're feeling. Once we sort of have that, a better grasp on that, it's a little bit easier to recognize, when our thoughts are not very beneficial for us and when they're very unhelpful. So, it can happen within, a couple of sessions, or it can happen later on. It really just varies. It varies depending on the person and what it is that they're experiencing. But you can definitely start noticing some changes fairly early on in therapy.
Okay, thank you. This additional person here asks a question of a very current issue that's happening. Do you have any suggestions for managing the fears of someone in a long-term care home right now?
Yeah, that is definitely something, that many people are concerned about. It's difficult. So I know that obviously visitation and all of those things have been restricted. So what we can do is we can look at what it is that the homes are doing to help prevent, people from getting sick from what's happening right now. We really need to focus on, what it is that people are doing in terms of, psychoeducation and medical education in terms of, how to prevent this from affecting that many more people, especially within long-term care facilities. It's okay to be worried. We need to feel that concern. It's normal. But I think what we need to focus on is, okay, well, everybody is doing what they can do to prevent the spread. And those are the things that we really need to focus on and sort of think about in terms of what they're not doing.
Okay, thank you. An additional question here is, you had mentioned a few apps in terms of mindfulness. Are there any other online counseling services that can provide interactive support for me since we can't go into actual clinics?
So, like I said, most of us sort of in my field are offering virtual sessions. So if there's somebody in your area that you've been working with before or that you've heard of, reach out to them, because all of us are pretty much able to provide virtual therapy. And it just depends on where it is that you are, obviously. But there shouldn't be a shortage of access for this type of therapy or anything similar, any type of counseling.
Okay, that's great to know that a lot of providers are providing some sort of online version of it.
Yeah.
One of our audience members asks, my tremor is exacerbated when I'm stressed. Besides relaxation practice, is it possible to train my body to have a different physiological response?
Interesting. without becoming sort of medical, because that's not, my expertise, but from what I understand, there actually has been some research in terms of some types of meditations and mindfulness that does sort of slow down an essential tremor. So I think it would probably be best to talk to somebody who provides that type of therapy, whether it's mindfulness, and yes, relaxation is known as well to sort of to decrease tremors. But I think it would probably be best to reach out to somebody who really works on that end. And again, I can't really provide any more expert knowledge when it comes to that, as it's not something that I can attest to. So I would reach out to somebody who does provide, whether it's mindfulness practices or relaxation techniques, to see if there's anything that they might be able to help you with.
Okay, great. The last question that we have right now is that I suffer from depression. This was the person is writing, and they'd like to know if they can do CBT as well as take their medications at the same time.
Absolutely. Yeah. So a lot of people actually do it, psychotherapy as well as pharmacotherapy, when it comes to depression or anxiety. So absolutely, if you're still finding that with medication, you're not feeling as good as you feel you should be feeling, then yes, absolutely, you can combine the therapies. There's no issue with that at all. Usually what we say is when it comes to depressive medication or SSRIs or antidepressants or anything like that, they can really relieve some of the physical aspects of depression. So, some of those physical symptoms that we experience, but it doesn't necessarily change the way we feel or the way we think about something. So definitely the combination of psychotherapy and pharmacotherapy can be very beneficial for many people.
Okay, fantastic. All right, and I think that's all the questions we have for today.
Okay.
So just in conclusion here, I'd like to thank you, Andrea, for your very insightful presentation, and also thank everyone for attending today's session. Please stay tuned.
Thank you.
Thank you as well again. Please stay tuned on the Parkinson Facebook page. You'll see the rebroadcast of this presentation, and you'll also be able to see upcoming webinars and Facebook live streams that are happening this week. Once again, on behalf of Parkinson Canada, we'd like to thank everyone for joining, and we wish you all an enjoyable afternoon.